we are going to see about diabetic retinopathy. In diabetic retinopathy, the three important terms that generally confuse us are cotton wool spots, hard exudates and retinal hemorrhages. I will tell you in short about all this. What is cotton wool spots? Diabetic retinopathy happens because of diabetic, the blood supply to the retina is not proper. There is not proper flow to the retina because of the condition diabetic. So, because of this, what happens? The retina is full of nerves, right? So, the axons that are present in the retina, the blood will not be supplied to those axons which are also present in the retina. So, now what happens? At the axon level, it suffers microinfarction. The axons in the retina will suffer microinfarction. So, since it supplies microinfarction, this axon will swell, and because of the stasis of axoplasmic material. This stasis is what is known as cotton wool spots. The stasis of the axoplasmic material because of the microinfarction of the axons is known as cotton wool spots. What do you understand by hard exudates? Hard exudates is that when there is the arteries, the arterioles or the capillaries which are supplying the retina are affected by diabetes. So, because of that, there will be leaky lipids and proteins will leak. Because this arterioles, the capillaries are not properly supplying the blood because of the diabetic condition. So, therefore, there will be leaky lipids and lipoproteinaceous material that will be presenting as hard exudates. What about retinal hemorrhages? As it is obvious, there will be hemorrhages seen in the retina because the blood vessels are not properly supplying the retina because of diabetes. So, these three are the important conditions which we see in diabetic retinopathy. Similarly, there are three conditions in hypertensive retinopathy. What are they? In hypertensive retinopathy, as it is obvious, the first one is arteriolosclerosis. So, as the name says, here the arterioles undergo sclerosis. What is sclerosis? Sclerosis is thickening of the arterioles. This happens because of hypertension or in hypertensive retinopathy. What is the second one? The second one is AVnicking. What do you understand by AVnicking? Here, because of the arteries are sclerosed, arteries are all sclerosed and it becomes thick. When these arterioles, when they cross the vein, so these are the arteries and this is the vein. Since the arteries are so thick, the vein cannot be seen or the vein is not appreciated. Or in other words, it looks as if the vein is being nicked or cut in between where the arterioles cross the veins. This is known as AVnicking. What about the third finding? The third finding is sausage shaped retinal arterioles. So, why should the retinal arterioles be sausage shaped? This is because of hypertension there is thickening and relatively there will be dilatation. There will be alternate thickening or there can be thickening at some places and the normal diameter arterioles will appear dilated. So, therefore, the thickening and dilatation of the arterioles will give the appearance of a sausage shaped retinal arterioles. The thickening is because of hypertensive retinopathy which causes sclerosis and this is the normal arterioles. So, therefore, it looks like sausage shaped retinal arterioles. In addition to this, cotton wool spots, hard exudates, retinal hemorrhages are the three findings which we saw in diabetic retinopathy, right? Those three can also be seen in hypertensive retinopathy. Those three findings are common to both diabetic as well as hypertensive retinopathy, but these three are much more specific for hypertensive retinopathy. I hope I made it clear in this whiteboard diagram. Thank you for listening. Have a good day.